Hey, everybody. So today, the 50th episode of the Dr. Terri Show. I have to say, before I jump into my topic today on GLP-1s, I just have to appreciate, when I started on this journey a year ago, I was just trialing it, seeing if people would be interested in what I had to say and what my colleagues and other friends in the industry had to say. And apparently people are interested because here we are a year in and on our 50th episode, and it's just caught on like wildfire. So I thank you. I thank you for being a listener. I thank you for your feedback, and really just appreciate, honestly, the opportunity and God using me in my gift of teaching and educating to pass that information on in a way that's bite-sized and digestible, I think, for a lot of people. And I think that is, from what people have told me, what they enjoy about this show. So thank you, number 50. And I'm going to talk and deep dive on the GLP-1s. I've had a lot of interviews with other physicians and clinicians about the GLP-1 receptor agonists, which are Semaglutide, Tirzepatide, and some of their other cousins, and they come by a lot of brand names, Victoza and Mounjaro and Rybelsus. And oh my gosh, there's so many, I can't even think of them all right now. But there's a lot going on in this space because now so many people are on them. And of course, there's a lot of information that's coming that a lot of people are not able to get off of them. Let's talk about that. I want to talk about why it's difficult to get off of them and why so many people are losing so much weight, but looking just older and just not very healthy. Well, a lot of that has to do with all the muscle loss that comes along with it if you're not on a really good program. And, I've talked in other episodes about the allopathic model, which is the Western medicine mindset of you have a problem or a symptom and here's a medication to fix the problem. But it really goes deeper than that. We really have to get to root cause. And when it comes to the GLP-1 receptor agonists, which I do believe have been a game changer in medicine. They've kind of really been miraculous to a degree because it's addressed the diabetes, the type 2 diabetes and obesity epidemic in a big way. There's a lot of shortcomings from them. There's a lot of politics involved that we've kind of touched on in other episodes. There's, this whole conversation around compounding pharmacies being able to compound them, and are they as efficacious? And you should only get a brand name drug, from a big pharmaceutical industry. And, we know more and more that those just simply aren't true. And there's opportunities to be had for patients that can't afford the expensive brand name medications like Mounjaro and some of the others from their conventional pharmacies. Because if your insurance doesn't pay for it, which many insurances don't pay for it anymore, it can be upwards to $1,500 to $2,000 a month, and that's a real problem. The other problem that we see with most of the commercially available products is their preset doses and injections. And many people can't tolerate those high doses and don't get the results because they can't stay on them. So there is a place for compounded medications. Compounded medications were designed for a physician to work with a pharmacist to create a version of a medication to suit a patient's specific needs that isn't commercially available. So many compounders are utilizing certain vitamins along with the GLP-1s to combat nausea. Many doctors want to be able to have their patients microdose or use much lower doses that can get the same effect as the much higher doses when it comes to weight loss. So there's room for both of them. The raw materials come from the same places. And so there's a lot of confusion in the marketplace around compounded GLP-1s versus brand. And so the jury's still out on a lot of these things. I'm certainly not here to make claims that one is better than the others. I have many patients that have gotten better results on the brand name. So it really depends on you as an individual and your clinician and what is going to work best for you when it comes to deciding where and what type of GLP-1 you're going to get. So I just kind of threw that in there because that's a big buzz in the healthcare community right now. And then the other thing I want to talk about is this conversation around muscle loss and how so many people, we call it the Ozempic face or the Ozempic butt. And that's because not only are people losing fat, but especially if you're older and you don't have collagen, fat makes your face look youthful, right? So you lose all that fat, but you're also losing muscle everywhere if you're not giving your body what it needs to build back muscle and replace muscle. Now, part of the reason so many people are losing muscle is because the GLP-1s are so effective at appetite suppression that people just simply aren't hungry. And so when you're not hungry and you're not eating, that's okay if you're obese and extremely overweight for a while, but at some point, your body is going to begin to break down muscle for protein, because your body needs protein for other actions in the body. So if you're not taking in enough protein, if you're not getting enough essential amino acids in your diet or in supplementation, you can and will break down muscle. And that is a really big problem, because that really defeats the purpose of what we're trying to accomplish. We need muscle. Muscle is the currency of aging. You need muscle for so many things, for bone structure, for strength, for walking, prevents falls. I mean, there's a myriad of things we need muscle for. And we certainly don't want our body to start breaking down muscle for the essential amino acids and the proteins that is needing. So how do you mitigate this problem? You have to ensure you get enough protein in your diet when you're on these medications. And, if that means adding protein shakes because you're so full that you don't want to have a whole meal or a big, piece of protein like chicken or fish or steak or whatever, you're going to have to supplement with some sort of protein. Many of my patients will utilize a hydrolyzed collagen powder with amino acids in it that is tasteless, clear. You can put it in water. You can put it in coffee. A lot of people use collagen peptides that have amino acids in their coffee. There's all kinds of flavors in chocolate. You can make a mocha out of it. There's also something to be said for taking extra amino acids. And there's all kinds of really good essential amino acid products on market that you can supplement while you're on these GLP-1s if you're not hungry enough to get a full meal. Now, if and when, if you are on a GLP-1 and you are sitting down for a meal, you really want to make sure you are getting enough protein and enough grain and enough, obviously, fiber. This is another big problem with the GLP-1s. People are not getting enough fiber. They're very constipated and they're having all kinds of gut issues because they're not feeding the good bacteria in the gut. Remember, we're trying to mitigate disease from overweight and obesity and type 2 diabetes. And one of the biggest disease processes with these chronic illnesses is inflammation. Inflammation that leads to cardiovascular disease, heart attacks, strokes, all cancers for that matter. And a lot of that inflammation, and I would probably say the majority of it, begins in the gut. And if you aren't feeding your gut enough fiber to increase the colonization of the good bacteria, you are going to have an overgrowth of bad bacteria that releases lipopolysaccharides into the system, which causes inflammatory response, not only in the heart, but in the brain, everywhere in the whole body. Increases cancer risk, increases autoimmune disorders. So fiber is a big problem. So this is the thing about the allopathic mindset, where you're just taking a medication to try to lose weight and it works, but the trade-off is all of these other problems that you just traded it for because nobody's teaching you how to do this correctly. So definitely need enough fiber. It's a big problem for patients with these GLP-1s. There's another great way to get fiber. When you don't have an appetite, you're not hungry, you need to find ways to get these nutrients in you without the volume of the food. Right. And also you're trying to lose weight. And so you're decreasing your calorie consumption, obviously. Another great way to get fiber is a product that's readily available. You can get it on Amazon. It's called Sun Fiber. Sun Fiber is a tasteless, odorless, clear powder that 1 scoop is 4 grams of fiber. I think we need up to 25 grams of fiber a day minimally. So we're all not getting enough fiber no matter what. But you can really, if you just add this to your coffee, add a couple of scoops to your coffee, add a couple of scoops to your water during the day, add a couple of scoops to your iced tea, it dissolves really well, and get your fiber. Feed those good bacteria in your gut fiber, and you can really avoid a lot of the inflammatory processes that end up coming along from GLP use, especially long term. Now, that leads me into the conversation about the long-term use of GLP-1s. Now, for type 2 diabetics, of course, type 2 diabetes is also reversible and preventable. So even type 2 diabetics that started on this medication because their hemoglobin A1C and their other diabetes markers were elevated, and they started on them and brought their hemoglobin A1C down, if they change their lifestyle, they can go off these expensive medications. These medications have only been on market for about a decade, maybe a little bit longer, starting with the original one, I believe, was Victoza, which was a form of semaglutide. And so we have safety data in diabetics on these medications, type 2 diabetics on these medications far out, but we really don't have any safety data yet, long-term safety data on the long-term use of these GLP-1 medications for sustaining weight loss. So we don't really know long-term yet, 10, 15, 20, 30 years out, what some negative long-term consequences might be. There might be none, but we haven't seen it yet. We haven't had these on market long enough, especially the newer ones that have come out, like Tirzepatide and some other new ones that are coming out. See, Tirzepatide's a GLP-1 and GLP-2 receptor agonist, and there's others coming out that is a GLP-1, 2, and 3. Retatrutide is one of them, and there's probably dozens of others that are going through FDA trials right now. But as these medications come out on market, you have to understand they are not designed, just like antidepressants and anxiety medications and blood pressure medications. By and large, the majority of the medications that we are placed on as a society, as Americans, and even globally, were never meant for long-term use. They are meant to put the fire out in a problem while you address the root cause and reverse the issue. In the majority of cases. Now, there are some hypertensive patients that it is no root cause can be found and they need their medications. And I'm not saying that. Medications have their role. But in patients that overweight and obesity is the root cause of their problem, or stress management is the root cause of anxiety, or a dysbiotic gut is the root cause of their anxiety and depression, getting to the root cause rather than being on these medications, which all have side effects in the long term, is really the goal, should be the goal of therapy between you and your clinician that's prescribing this to you. So one of the first questions you need to be asking if you're either on these medications or going on these medications for your clinician is, how long should I be on this, especially when you meet goal weight? Now, I'm seeing this a lot in my patients, and we've been prescribing these medications for several years. They lose the weight, they get to their goal weight. Now what? Well, now what the conversation is, we figure out how to wean you off these medications because it's a lifestyle change. It's just meant to jumpstart your weight loss while you change your lifestyle. The problem is so many people want their cake and eat it too, really. And technically, these GLP-1s kind of allow you to do that. But the trade-off is going to be cancer and other chronic diseases if you don't change your lifestyle. I know a woman, it just comes to mind right now. She's on a GLP-1. She's very, very thin. These are the people I call skinny fat. They're very thin, and they have they're underweight, but they have the metabolic clinical picture as if someone who is overweight or obese. And this person is a very thin, type 2 diabetic. She's a type 2 diabetic because she has a sugar addiction, and every day her primary nutrition, not even nutrition, fuel is sugar. So she was placed on the GLP-1 receptor agonist. Great. It's helping her utilize the glucose that she takes in a better way, and it has brought her A1C down, but she still eats so much sugar. Oreos, Snickers bars. I mean, it is unbelievable the crap this person eats. But she's got this allopathic mindset, and I don't prescribe her the GLP-1s. First of all, that would not be a patient that I would probably partner with in their health because they're not interested in being healthy. But her regular physician just prescribes that to her and has not at one time had a conversation about her diet with her. And the problem with this person is she will eventually be diagnosed with cancer. I can lay money on it because cancer is fed by glucose. The more sugar you have in your diet, the higher your risk for cancers, especially breast cancers, colon cancers, and some of those other ones. So the whole point of what I'm trying to say is you have to have a strategy and a goal when you start on these GLP-1 receptor agonists on how you're going to get off of them. Because really, life change is the key. So addressing your diet, and I can't not talk about exercise. I mean, guys, there is no way. I mean, yeah, there's a way. The GLP-1s are a great way. You can lose all the weight without even having to exercise. But again, the trade-off is you're losing muscle, you're losing bone, you're losing everything that is vital to the aging process, vital to keeping you from falling down and breaking a hip and being in the hospital, falling down, hitting your head and having a concussion or a brain bleed. You need your bones and muscle structurally sound for your life. Right? So if you are one of those patients of someone that is prescribing you a GLP-1, or you have a loved one that's on one of these medications, have a conversation about the goals in getting off and what do you need to get off of them and sustain and maintain your weight if you went on them for weight loss, or you've gotten your hemoglobin A1C down, you're no longer a type 2 diabetic. How can I sustain that? Well, it is all about diet and exercise, and that has to be a part of a healthy lifestyle. Not only that, I want to go back to sugar. Alzheimer's disease is also now considered type 3 diabetes. We know now unequivocally that uncontrolled blood sugars increases the rate of Alzheimer's disease. Now, even on these GLP-1s, you have to change your diet. So although these medications are doing wonders for what we're seeing with disease prevention, obesity, and all the complications of obesity and metabolic syndrome, if you will, which are cardiovascular disease, cancers, Alzheimer's disease, all these things. The thing to really understand about it, it was never meant, and it is never meant to really be a lifelong medication. So when you're getting to that point about you've met your goals, what do? Well, in our practice, we start titrating doses down, we start going every other week, and we start trying to find that sweet spot where the patient can be on the lowest dose and maintain their goals, and we hang out there for a couple of months. And then we start saying, I wonder if we can come down on that once a month dose you're giving yourself, because you're maintaining your goals the rest of the month that you're not on this medication, that you haven't given yourself a shot. So there's a lot of different ways you can work it, but getting off of the medication should be your goal. So I think I covered kind of the main things that come up in my office all the time, come up in conferences that I'm speaking at regarding the GLP-1s. And a lot of it has to do with exactly what I talked about. Why are you on it? What's the goals of your therapy? How can I not lose muscle? And how can I maintain my goals once I'm off? Thanks for joining.